Better Living with Liz Walker is brought to you by Partners Healthcare.
Hi everybody, I'm Liz Walker. We're here on Boylston Street, the scene of the 2013 Boston Marathon bombing, an event that shocked the world and left this city in a state of trauma. Physical, emotional, and psychological wounds that take time and work to heal. Tonight on Better Living, we're going to look at the impact of trauma on individuals and whole communities. Most importantly, we're going to talk about ways to heal. That's what we're calling our show tonight, Healing. We begin with the story of some residents of one community.
It was exactly 2:22. I don't know why I remember that, but I do. And the phone was ringing, I picked it up, and the other voice said, "You better get to Brigham and Women, because Corey has been shot."
It's been 4 years since Debra Johnson got the call that is every parent's nightmare.
I think I knew right away that he was gone. But it was a kind of numb feeling.
Corey Johnson is one of hundreds of homicide victims over the years in Boston. The loss that his family experienced has left them all struggling with trauma, a situation that Boston Mayor Marty Walsh has put as a priority for his administration. Why did you make trauma treatment or trauma intervention a priority?
Well, you know, over the years, you saw a lot of the violence and deaths occur in Boston. And when I decided to look into it, I realized there was very little trauma treatment. And I think as somebody in recovery that's recovering from alcoholism or drug addiction, the way that they get better is by treating their illness and treating their disease. And you don't just get better by stopping drinking or stop taking drugs. You need to deal with some of the wreckage of the past, they call it. And I felt that violence is a lot of that's the same. You have young people who lost relatives or brothers or sisters or friends, and the first thought they have is revenge. And if we don't deal with the trauma, you're never going to deal with the revenge.
Is revenge a real issue in?
I believe so, because, for example, it's like you take something from me, and I'm going to try to take something from you, and it's going to go back and forth until none of us got nothing left.
So it's pretty bad, huh?
Yeah, it's pretty bad.
We live in a traumatized neighborhood. Everybody's traumatized.
In a traumatized neighborhood, and we live in a traumatized city. And there's no limits to how trauma has impacted, you know, families and folks that work in this community as well. At some point when the violence began, we were dealing with it as individualized. But now we have to look at it from a place of how are we going to treat trauma as a whole community? As trauma has set into entire neighborhoods, into our entire city.
My son left out of the house, told me he would be back, you know, soon, and he ended up on a bus, number 28 bus, where he was texting on his brand new phone that he got for Christmas to a few friends and a cousin, and apparently somebody that was sitting behind him began stabbing him repeatedly on the bus ride. So he never even knew what was happening.
I lost my son Jimmy, who was my oldest son, in August 20th, 1981. So that's 33 years ago, August. What happened was he had asked me could he go out to what they had back in the 80s, they had like block parties. He wasn't gone 10 minutes when the kids ran back and said, "Miss Flint, Jimmy's been stabbed." Before I could get there, the kids are carrying him home, right? And these kids were from the age of, I'd say 10 to about 17. So I know the trauma that they went through.
Sometimes we look at problems that we see on TV and say, well, it's their problem. Why should the whole community care about trauma?
I think trauma doesn't discriminate. I think trauma is from car accidents, suicides, of course homicides, and penetrating injury. That is pervasive across every demographic in this country. And I think the marathon bombing here in Boston clearly showed that the world is impacted by trauma. But even if we said it was just happening to, say, inner city young people, they have teachers, case managers, friends in the family that are much more diverse. All of them have primary and secondary impact from either having a loved one lost or having a loved one injured, witnessing. It applies to every human, at least in America.
problem is we have an enormous amount of trauma that has gone untreated for a very long time. That trauma has reached different stages from the beginning to now we're dealing with lots of mental illness.
So it seems like such a huge problem that covers so many different areas. How do you even begin to try to handle this, to work on this?
Well, I think a couple things we did this year in the budget is we put more money in there to do trauma prevention in the health centers in Boston, but also, like you, the clergy. It's important for the clergy where they can in their own churches, in their own congregations, to set up some type of trauma counseling. I think we have to spread it out. We can't just do it. It can't be the city only. It can't be the clergy only. It has to be a concerted effort of everybody getting together. And how do we deal with this issue together?
Before you can deal with any problem, you have to fully understand it. Coming up next, we're going to look at the long-lasting and far-reaching impacts of trauma. Stay tuned. There are some neighborhoods in Boston where just about everybody knows somebody who's been the victim of violence. Behind that disturbing fact is an even more shocking one: the collateral damage of trauma. When Aretha Mauge's son, Devante, was stabbed to death on a bus New Year's Eve, 2008, her life became a living hell.
I had supporters that would come and help me cook, even clean, wash clothes. None of that I did. I just didn't feel like it. I didn't think that I needed to cook anymore because he wasn't there for me to cook. I tend to neglect a lot of things, and the way I was feeling, alcohol became a big part of it. But one day I woke up and I said, I can't do this. This is not me.
I was at an event yesterday and there was a stat. Somebody talked about the veterans coming back from Afghanistan. This April that we just passed, there was 0 deaths in Afghanistan, although there was 700 suicides. That's trauma untreated. So we take the soldier out of the situation they're in, bring them back home. That war didn't end for them when they got in that plane and came back to the United States of America. That war kept going. A lot of that we can look and see the violence in the street. Simply when we go into these young kids and try and get into their brains a little bit, their violence, their trauma doesn't stop at a funeral of a loved one. It doesn't stop there. It keeps going. So that's what I was talking about. What we can do with trauma is to go in there. The city needs to do a lot better job with trauma. We've done a pretty good job, but I don't think we've done nearly the job we can and will do.
So what happens to you? Here you are, you're doing the right thing, you're in school, you're doing what you're supposed to do, but you have to kind of be confronted with this. How does it affect you?
It affects me because when you're a kid that plays sports and does a lot of activities, and to live in the hood is not like good because people might look at you the wrong way and think that you're part of this stuff, or just being like living in a bad neighborhood just might make you look like a bad person when you're really not.
So here's one thing I want to just say about traumatic exposure. 50 people might be injured in a year. They might be loved by 100 people. That's 5,000 people potentially impacted. They might not use services, and they also might affect other people if they're not taken care of. So if I behave a certain way, my wife might be impacted and also be changed by my behavior. So if there's a bit of a contagion factor.
I actually had a stroke, but God is good. He brought me through it. I prayed to him to let me get through losing. Sorry.
No, that's all right.
Losing my son. It's so hard. I try not to break down like this, but it never gets better.
We have a problem. The city has a public health problem, and that is trauma. We have to begin to think about what are the strategies that need to happen in order to engage the trauma. We have to begin to have these small conversations in safe places where people will begin to share their experience and begin to come up with solutions that they can agree on.
What is Boston's most important tool overall against violence in a community?
I think it's our best tool is that there's so many caring people. I think there's so many caring people. I think the faith-based community is tremendous. I think we have neighbors and coaches and sports leagues that are vested. I don't think our Boston Public Schools get enough credit. I think we have some great people in our Boston Public School system that wants to continue to work on this issue and eliminate violence in the city of Boston. I think our people are our strength.
When we come back, we'll look at how Boston is healing from trauma from the perspective of healthcare institutions, community centers, and victims themselves. Violence is now clearly recognized as a public health issue, and healthcare institutions across the country are putting more and more resources into trauma treatment.
So what you're trying to tell me is that
The violence recovery specialists at Brigham and Women's Hospital stay with patients long after their initial wounds have healed.
My job description covers many different areas of care. I work for Brigham and Women's, and I see victims of intentional violence. We concentrate on community violence. However, violence comes in many different forms.
My role at Brigham and Women's Hospital is running the violence prevention program. We sit in the Center for Community Health and Health Equity, and so really what we're looking at is how access to peace, safety, and healing are social determinants of health and how they impact other health outcomes for different populations. Here's the Mother's Day Walk for Peace, me and my daughter with one of the surgeons. We had a whole team of people from the hospital. This is a memorial for a young man in a neighborhood I've done a lot of work in.
Give me an example of an incident and walk me through it.
Here's an incident I can describe. 7 in the morning, I get a text from a 16-year-old girl that we had served in a prior incident of homicide. So she was exposed to the services and she utilized them. 7 in the morning, she says, there was a shooting I just saw. And at the same time, the EMS notifications of just, EMS call, we have to pick up someone for this reason. I started getting that. And then all of my partners in different agencies started to send each other information. That's the school department, that's the hospital folks, and even some of the ministers and reverends that we work with. So then I actually send a few other communications out and we have a huddle-up call.
I get paged from the hospital. So I respond to the hospital, whether the incident is someone has survived or hasn't survived. And in which case, it could be a totally different scenario, right? But I think the underlying thing is to provide support to the victim in case of homicide, support to the victim's family. I think the first line or the first initial response is to make sure that you're humanizing the person who comes into the hospital.
For people that are in unsafe situations, who are experiencing violence, we need interventions that don't blame them, that don't ostracize them.
The hospital did take very good care of me. I felt as if I was comfortable, but in a situation that I was in, where there's normally is, I had to worry and feel as if my safety was at harm. When you came, actually, I felt as if I was in actually better care because you asked me questions about how am I doing in all areas of my life, education, my job, my relationship with my family. So you made me feel as if, I wasn't just going to be treated and streeted.
At the individual level, though, there is a sort of an approach that I think is important to note, which is having an asset-based approach. So instead of saying your life was fine and then you had this exposure, and so you fell down, you changed, and now we're going to bring you back to where you were before, bring people back to normalcy. We'd rather bring people back to a higher point than before the accident even occurred, before the traumatic incident even occurred. They call that post-traumatic growth.
We work with Courtney Gray, and I know the mayor's made a commitment to get more of Courtney. More people like Courtney out there, so we can get involved in the community. And so, people aren't locked in their homes. They don't have what's called like a mean world syndrome.
It's a citywide effort. Every day that we prevent a violent act is a successful day. We do that with our street workers. Out of the Boston Public Health Commission, we also have people go out and work in community to try to prevent violence, right, and stop violence before it happens.
How many more people do we need doing this work? It's healing the community that they're going back to, and the families are a part of that, the friends are a part of that. So the more hands on deck, the better.
I'm actually moving forward from that process where I'm having starting two jobs. I'm getting started on my GED, and we're talking about my CDL license. So it seemed like from there on, you were a very big help to me.
So how does this kind of counseling or intervention, trauma counseling or trauma intervention, end the cycle of revenge? How important is that?
Well, when people, during the campaign for mayor, one of the young men on my campaign, his friend got shot. And off of Dudley Street. So I went to the victim's house, and I was sitting in the curb with him, he was crying, looking in the yard, and I saw young men in the yard who were upset. I saw his little cousin come out, who was about 10, and I thought to myself, the young men, you could see in their eyes, all they were thinking about, who did this and let's get them back. We have to stop that.
Gentlemen, first of all, we're talking about trauma. How important is it for public and private partnerships in trauma intervention in this city? Dr. Courtney?
Oh, it's critical. You know, violence is unfortunately ubiquitous, and it's critical for us to have programs together to be able to understand what our communities need, how to be able to intervene, and how to focus on both prevention as well as intervention when it's necessary.
No, absolutely, and also, you know, the hospitals have the expertise here in the city of Boston when it comes to trauma, and the first responders bring people to the hospital, and the nurse and doctors see the trauma firsthand. So, and we have to go back out to the community more and do more with the families that are left behind with the tragedy. And I think we've seen a lot of that already in Boston. We have to do more of it, and I think working with our hospitals through our health centers is really where that I see a real positive relationship that can turn into something good for the city.
An example of a partnership that we've done is in social and emotional learning for kids and their families. So working through 23 different public schools with about 7,000 students and working with Open Circle as well as with principals and teachers, we've been able to teach kids about self-expression, about how to communicate, and how to have tools that help them to both intervene before there might be violence and also to respond to it in a way that's productive.
Thank you both.
Thank you.
Thank you. Thanks, Doc.
Great to see you.
Right now, there are health institutions, community groups, churches, and individuals working on trauma treatment all over Boston. There are a number of different ways to approach it.
Good morning, REVERE Health Center.
At the MGH Health Center in Revere, a program called Haven is teaching young people how to avoid violence through healthy relationships.
Haven stands for Helping Abuse and Violence End Now.
My best friend has been in a cycle of abusive relationships. I've had abusive friendships, and this club has helped me actually recognize that, because I never saw certain things as abuse until I joined this club.
I was involved with RHS Youth Empowerment in high school because I saw a trend of domestic violence within my friends and family, and I was curious to find out more about it and kind of to see what helping hand I could give.
I do a lot of work with teens in the community here in Revere, so my role includes a lot of the one-on-one counseling. I get referrals through the school-based health center at the Revere High School. It's so important for people to know that there are programs like Haven, and there are students in the community that really care about this issue and want to be able to provide that support.
In Roxbury, an organization is helping violence survivors turn grief into activism. Monalisa Smith is the founder of Mothers for Justice and Equality.
My nephew was murdered in 2010. I watched my niece stand there and say that that is my son. That's my son. And I watched the police officer just stand there and say, ma'am, move back, move back. And she's screaming, that's my son, you know, that's laying there. And no one should ever be put into that place.
I remember when I became commissioner, I had a meeting with Monalisa Smith, and she said to me, you know, I wish people, you know, the police would understand what the families are going through. And at that point I said, Monalisa, why don't you come and speak to our police academy and let us know what you know, the feelings, the emotions, so we have a better understanding. And she just did that with the most recent academy, but I think we can do a better job.
One of the newest projects on trauma treatment is underway at my church, Roxbury Presbyterian. The program is called Our Voices, Our Stories. The church, in collaboration with Partners Healthcare and Still Harbor, is offering a safe space for people to gather to share their experiences of trauma, loss, and healing.
I feel like it's my generation that's being affected the most, and there aren't too many people that look like them, that want to talk to them. I just think it's so necessary to have these conversations.
And I lived trauma. I've watched 5 of the young men from my neighborhood be shot. I helped my next door neighbor bury her son who was murdered in Walgreens parking lot, and they've threatened to kill my child at least 9 times. So
What good is a public conversation in having any kind of impact on such private pain?
What we now know about trauma is, I think, one of the worst symptoms that come from it is the disconnection. And people will tell you that they're disconnected from themselves, they're disconnected from their God or their spiritual life, they're disconnected from family, friends, and then the greater community. And the more that we learn about this, we realize that connection and reconnecting is the way through healing.
Why did you decide to put yourself out and join these public conversations about trauma?
Because I think I'm ready to do something. I want to be able to help someone. Even though I feel like I'm not, or I will never be over it, I feel I'm in a place now where I can reach out to somebody. Because, you know, when I see people who are just so raw, you know, like it just happened and they're just numb, I feel like maybe I could say something that would help them.
Not 2 weeks ago, you know, a young man was shot. So we were at the hospital, and he happened to be one of the young people that we work with personally. And so, you know, the young men were Instagramming his group of young men he hangs out with. The rival that shot him saw this on Instagram, and he came to the hospital, and someone told the mom that the young man was outside who shot her son. And I was running towards her, and my co-worker was running towards her. The young man pulled a gun out. When he pulled the gun out, he pointed it at her, and she moved, he squeezed, but the gun didn't work. And I'm looking down the barrel of the gun. For me, that was a heavy day for me. You know, I went home, and I just went and hugged my kids, kissed my wife, and I just sat still for a little while because, you know, it could have been a rough day.
What can we learn from the terrorist attack on the city of Boston?
You had this bombing happen, and people in many ways reacted very appropriately. We came together across neighborhoods. We came together as one city. People probably connected in ways they've never connected with neighbors and individuals and other parts of the city. So that, for me, is more of a model or a way of response that we've shown works.
What do you think might be one of the most important things a person could do for someone who has just gone through the shock of losing someone or being a victim of violence themselves?
Listening, just listening. I think that a lot of people don't want to really tell their story a lot because they think that they're burdening people, or, you know, you bring them down, but really, you need to tell it. You need to remember good and bad, you know, whatever you need to do.
The community conversations at Roxbury Presbyterian Church will continue October 16th and November 13th. You know, the kind of trauma that we've talked about tonight, whether it's individual or collective, has to be dealt with, or it festers and grows, and that can be dangerous to all of us. The good news is trauma of any kind can be treated, and there are competent and caring people around right now who can do so. If you are struggling with emotions or feeling isolated or unsafe because of something you've witnessed or experienced, seek support from a relative, a friend, or someone you trust. That is the first step of healing. And trust me, you're worth it. I'm Liz Walker. Thanks for joining us.
Better Living with Liz Walker is brought to you by Partners Healthcare.